it's some care statements. I think it's very good news. Many of you know major advances have been made during the past several decades in stroke prevention, treatment, and rehabilitation. Despite successes in delivery effective new therapies, significant obstacles remain in ensuring that scientific advances are consistently translated into clinical practice. In many instances, these obstacles can be related to a fragmentation of stroke-related care caused by inadequate integration of the various facilities, agencies, and professionals that should closely collaborate in providing stroke care. There's now increasing emphasis being placed on improving the components of stroke care, and it is critically important to look carefully at how the distinct components can better be integrated into a stroke care system. In 2003, the Joint Commissions, formerly known as JCO, developed a certification process that allows hospitals to achieve and be recognized as primary stroke centers. In our county, both the San Joaquin General Hospital and St. Joseph's Medical Center maintain these designations. Research indicates that patients receiving care at primary stroke centers have a higher incidence of survival and recovery than those treated in hospitals without such specialty designations. In general, the fragmented approach to stroke care that exists in most regions of the United States fails to provide an effective integrated system for stroke prevention, treatment, and rehabilitation because of inadequate linkages and coordination among the fundamental components of stroke care. Although individual components of stroke systems may be well developed, these components often operate in isolation. There are 31 local emergency medical services agencies covering California. Some have single county jurisdictions, others have jurisdictions over multiple counties. State statutes and regulations empower California Emergency Medical Services Authority to provide oversight to local EMS agencies, to develop and implement EMS processes, which include establishing EMS dispatch for the purpose of triaging requests. These are 911 calls for service and coordinating available and appropriate response. Local EMS agencies also provide oversight of certification, accreditation, and education of pre-hospital care providers, development of patient care and destination policies, and designation of specialty care centers. These responsibilities empower local EMS agencies to develop systems of care, such as designation of acute care hospitals and trauma centers, standard receiving centers, and stroke receiving centers, as well as managing policies for ambulance providers to transport patients with identified need to such specialty care centers. Recognizing its role in building a stroke system of care, the San Joaquin County Emergency Medical Services Agency has developed a stroke system plan that addresses the continuum of stroke care from first symptom to recovery. The goal of this system will be to promote public awareness and improve early recognition of stroke. That is basically the right patient to the right place within the right time. To meet these goals, the EMS agency will develop destination policies for triaging and transporting stroke patients, preferentially to hospitals that the EMS agency will designate as appropriate stroke care sites. What will emerge is a stroke care model that parallels the existing STEMI and trauma systems. The stroke plan also includes affiliation with comprehensive stroke centers that are located outside of the county. As EMS works to develop the stroke systems of care in the county, they will assure standardized protocols for dispatch that recognize the emergent nature of stroke, and dispatch stroke will have the same urgency as trauma and AMI. The stroke center of care will include continuous quality improvement processes and measures to ensure that dispatchers and other participants consistently and correctly follow written protocols. This will also include a stroke registry for monitoring. We're still in the very early stages of this process, and I appreciate the San Joaquin County Board of Supervisors approving our request to add additional staffing to the EMS agency. I don't see Mary Barnes here, but she is an RN with the Emergency Medical Services who will be coordinating our stroke process within EMS. She has been hired. We have released for public comment the stroke designations. I know some members in this room provided public comment. We are looking forward to actually taking applications from hospitals who used to be designated as stroke destination centers as of July 1st of this year. We welcome input in this process from all interested parties as we progress toward improvements in patient care. And I'd like to actually thank Mary for her championing of this effort. And I think this is a good news and a next step in our pathway. So thank you.